right cheek sharp, chin dull.
Okay, great. My patient's facial sensation is intact. So now we're going to go ahead and we're going to be testing for mastication. So this requires for me to put my hands on your temporal mandibular joint, TMJ, and I'm going to have you bite down for me. Okay? Bite down. Okay, great. My patient's TMJ is intact. I was able to feel her bite down, so she's able to masticate, so that is intact. Okay, so now we're going to be moving on to cranial nerve number 7, which is known as facial. For cranial nerve number 7, I will be testing my patient's facial expressions. And the way I would do this is by having her smile, frown, and puff her cheeks. So can you go ahead and smile for me? Can you frown? And can you puff your cheeks? Okay, great. My patient's cranial nerve 7 facial is intact. So now we're moving on to cranial nerve number 9, which is known as glossopharyngeal, and I'll be testing her swallowing for this cranial nerve. Okay, so I'm going to go ahead and put my hand over your trachea, and you're going to go ahead and you're going to swallow for me, okay?
Okay.
Swallow. Okay, great. My patient's cranial nerve number 9, glossopharyngeal, is intact. My patient was able to swallow. I felt her swallowing, so that's not a problem. Now we're going to go ahead and move on to cranial nerve number 10, which is known as vagus. So I'm going to have my patient, I'm using my pen light again. I'm going to have my patient open her mouth, and she's going to say, ah, for me. And I'm going to be looking inside her mouth and inspecting more. And I'm going to be just looking for any abnormalities. Okay, so can you open your mouth for me, please? Say, ah. Can you stick out your tongue? Okay, great. Can you show me your teeth, please? So teeth are white. Teeth are not, there's no broken, no missing teeth, no signs of rotting. Can you open your mouth for me again? The uvula is midline. Her mouth is pink and moist. No signs of dryness, no open wounds or any drainage that I can see that's abnormal to sight. As I said, her lips are not dry. They're pink and moist. Can you go ahead and stick out your tongue again and move your tongue up and down for me and side to side? Okay, great. So, also her tongue seems healthy. Doesn't seem to have any cuts on it or any abnormalities, any lesions, or anything else visible to sight. I had my patient move her tongue up and down because I was not only testing for cranial nerve number 10 when I had her say ah, which was vagus, but I also was testing cranial nerve number 12, which is known as hypoglossal, and that is the tongue movement, and my patient was able to do that. So now I'm going to be testing cranial nerve number 11. Cranial nerve number 11 is you're testing the accessory muscles. So I'm going to go ahead and put my hands on top of her shoulders, and she's going to shoulder shrug for me, and I'm going to push against resistance in this cranial nerve. Okay, so can you move your hair for me real quick? Thank you. Okay, now push. Okay, great. My patient's cranial nerve 11 is intact. So I have tested and gone through all cranial nerves, explained, inspected, and palpated my patient's head. So now I'm going to go ahead and I'm going to move on. I'm going to go ahead and move on to the neck. I'm going to be testing for the range of motion in her neck. So can you go ahead and move your head side to side for me? Up and down and in a circle. Okay, great. My patient's neck. My patient has range of motion in her neck, so that's not an issue. And since I'm already testing range of motion, I'm going to go ahead and have my patient, I'm going to test other range of motions. So I'm going to do lower and upper extremities. Upper and lower extremities. So can you go ahead and move your arms out for me? Can you move them up and down, side to side? And can you move your wrist for me? Okay, great. And can you go ahead? Can you stand up so we can see her? Okay, great. Can you move your legs side to side? Okay, great. Up and down. And can you move your wrist for me? Your ankles. Awesome. Okay, great. My patient's range of motion is intact. My patient was able to do everything I asked of her. So there's not a problem with that. And since I'm already doing it, I'm going to go ahead and test for her strength. In her her upper and lower extremities. Okay, so pull out your arms for me, and I'm going to be pushing against resistance, okay?
Oh, okay.
Okay? Ready?
Mm-hmm.
Okay. Okay, great. My patient's strength is +5, and now your legs, can you straighten them out for me? Okay, great. Pushing against resistance. Perfect. So both upper and lower extremity strength is +5. So it means her strength is good. She's not lacking, no signs of weakness. Definitely strong and healthy. And now we're going to continue on. So I'm going to be moving on to the heart. I'm going to be doing a cardiac assessment. So I'm going to be listening to I'm going to be listening to the heart, as I said before. But before I do that, I'm going to go ahead and I'm going to be I'm going to be testing her, I'm going to be checking her pulses. And in the body, we have many pulses. So first, I'm going to start off with her temporal pulse. So I'm going to go ahead and feel. I'm going to do this bilaterally. Okay, I feel the temporal pulse and it's +2. Now I'm going to be doing the carotid. The carotid is in the neck, but I won't be doing this bilateral. I'll be doing one at a time because you can occlude. Or it can, the carotid artery can become occluded by doing it bilaterally. And you also cut off the patient's airway. Okay, now the other side. Patient's pulse is +2. So now I'm going to move on to the brachial. I'm going to do these bilaterally. Okay, +2. I'm moving on to the ulnar pulses. +2 as well. And then I'm not going to be doing this on my patient today, but I would also be checking her femoral pulse, which is here in this area. So I would feel bilaterally as well on both sides. I'm going to go ahead, I'm going to feel for my patient's pulses behind her knees, which is known as popliteal. +2 as well. Now I'm going to be doing the feet on top of the foot, which is known as dorsalis pedis, and towards the back here, which is posterior tibial. Okay, +2 and +2 as well. Okay, great. So all my patients' pulses are intact, so there's no problem with that. And I'm going to go ahead and continue on. So I'm going to be doing my heart assessment, as I said. So first, I'm going to go ahead and I'm going to listen to my patient's aortic valve, which is located at the right of the sternal border in the second intercostal space. Now I'm going to move on to the pulmonic valve, which is located in the left of the sternal border in the second intercostal space. Okay, now I'm going to move you down to the tricuspid valve, which is located in the third intercostal space left of the sternal border. Okay, oops, sorry. And now I'm going to be listening to my patient's apical pulse, which is known as point of maximum impulse, also known as the mitral valve. And this is the best heart sound that you can listen to in the body. In case of an emergency, if you hear the patient having a irregular heart sound, you always want to make sure in the mitral valve, because that will be the best heart sound you can hear. So since she is a female, I'm going to ask her to lift her breast for me, and I'm going to be listening. It's also located in the midclavicular line, and I'll be listening for a full minute. So I heard my patient's love dub, which is great, S1 and S2 sounds. So we know that her heart is working and pumping. Okay, so also since I'm doing my heart assessment, I'm gonna go ahead and be checking I'm gonna check her nail beds. I'm gonna be checking for capillary refill. So I'm gonna go ahead and I'm gonna press down on her nail, and I'm gonna see if blood comes back within 2 to 3 seconds. Okay, great. Patient does not have any issues with her capillary refills. So I'm going to go ahead and move on to, I'm going to be doing the lung assessment now. Again, I will be using my stethoscope. So I'm going to have my patient turn around. Now we're listening to all the lung fields that we have been taught to do. So I'm going to be starting at the apex of the lung, which is right here. I want to have my patient breathe in and breathe out for me. Okay, great. Let me go ahead and put these on really quick. Okay, breathe in and breathe out. Great. Now I'm going to also here, other apex of the lung. Okay, breathe. Again. Okay, great. Again. Just 2 more times, okay? Okay, great. No signs of rhonchi, no signs of crackles. My patient's lung sounds were clear. You can go ahead and turn around for me. Thank you. Oh, since I already did the lung assessment, are you a smoker?
No, I'm not.
Okay. Just wanted to make sure. Okay, so now we're moving on to the abdomen. I'm going to be starting in the right lower quadrant. Well, first, I would be inspecting her abdomen. And as I inspect her abdomen, I'll be looking for any abnormalities, any bumps, any abdomen distension, any bruises, any discoloration. But I'm not going to have her do that today. And after inspecting, I would go ahead and I would be listening for bowel sounds. And then after listening to bowel sounds, if bowel sounds are not present in each of the quadrant, I will listen to each quadrant for 5 minutes. And after doing so, I will go ahead and I will be percussing and I will be palpating on her abdomen. Also, I forgot to mention that when I'm doing the heart assessment and the lung assessment, I would also, since when I'm doing that today, the patient would be in a gown normally, I would be inspecting her skin and I would also be palpating as well for pain. Since I didn't do that for the back, I'm going to go ahead and I'm going to palpate and you tell me if you feel any pain, okay?
Okay.
You feel any pain when I touch you?
No.
No? Okay, great. And now since we're up already, since we're doing this, can you go ahead and stand up for me? I just want to check on your spine. Okay, so go ahead and touch your toes for me. Okay, so patient's spine is straight, no signs of lordosis, kyphosis, or scoliosis. You can go ahead and stand up for me. Okay, great. Can you go ahead, can you stand back here with me? And I want to test your gait.
Oh, okay.
Okay, so can you go ahead and just take it to a few steps for me? So patient is walking normal, patient is not slouching, patient is not any signs of distress, walking normal as she should, and so her gait is intact. So she doesn't have a problem with this. You go ahead and sit down for me. Thank you. Okay, so as I said, we'll inspect her abdomen, we'll look for any abnormalities, and then I'm going to go ahead and be listening for bowel sounds. I'm going to start in the right lower quadrant. In the right lower quadrant, you have the cecum, you have the appendix, you have the right ovary and tube, and the right ureter. And you also start in the right lower quadrant because of the ileocecal valve. Can you go ahead and lean a little back for me? Okay, great, thank you. Okay, bowel sounds present in the right lower quadrant. Now I'm going to move up to the... Now I will be moving on to the right upper quadrant. In the right upper quadrant, we have the liver, the gallbladder, and the head of the pancreas. And as I said before, I'm going to be listening to bowel sounds. And if I don't hear bowel sounds, I will listen for a full 5 minutes in each quadrant until I do. Can you lean back for me? Or do you, okay. Oops. Okay, bowel sounds present in the right upper quadrant. Now I'm going to move on to the left upper quadrant. And in the left upper quadrant, we have the stomach, the spleen, and we have the body of the pancreas. Again, I'll be listening for bowel sounds. Bowel sounds present. And now I will be moving on to the last quadrant, the left lower quadrant. In the left lower quadrant, we have the descending colon, the sigmoid colon, the left ovary and tube, and the left ureter. Okay, bowel sounds present in all quadrants, so I did not have to go ahead and listen for 5 minutes in each quadrant. So no signs of bowel obstruction. And since I've already